Hi, it's Dr. Robert Brueck coming to you again with some basic introductory sessions concerning some of the more common cosmetic procedures. To my right here is our new toy. It's a very expensive toy, but it's a great toy. It's called Sculpsure to help eliminate unwanted deposits of fat. It's non-invasive. The treatment takes about 23 minutes. You come in, literally put the treatment heads on the area of the body you want treated. In 23 minutes go home, and it takes about 6 to 8 weeks. So you're going to be hearing more about this. There'll be a link in the website, and it's nice because it's outpatient, no needles, no injections, no pain, no downtime. I want to spend a little time today talking to you about facelifts. I do a large number of facelifts. It's something that I've had a particular interest in for years. And in my 37 years of experience, I've done everything from minimally invasive to the most aggressive facelift. But the technique that I utilize now is what we call a quick lift. When we're talking about facial aesthetics, we're talking about, in my opinion, two things. We're talking about things on the surface. We've got fine lines, we've got brown spots, sun damage, things of that sort. And those are very, very real. And as we get older, they become more prominent. The second aspect of facial aging is the loss of soft tissue. So if you were to look at somebody at 20, 40, 60, and 80, you'll find that they lose soft tissue volume or fat in their cheeks, in their face. They have loose skin. And many people have these bands in their neck. We call those platysma bands. Normally when we're young, that muscle crosses and decussates. As we get older, they separate and you get those columns. Now what makes the quick lift unique is that you can go ahead and take the soft tissues of the cheek, you can elevate them, and then you anchor them to the bone, the malar bone right here. Now when I do the neck, I do a suspension platysmoplasty, and it's not something I invented, it's something that I do. But what it is you take the bands of muscle, you put a stitch through this sheet, you loop it around right above the thyroid cartilage, and then a corresponding one on the other side, and then they lock or interdigitate right above the thyroid cartilage, and you take that whole neck and you anchor it to the bone behind your ear. So in this particular facelift technique, you're taking soft tissue that's hanging, that's loose, and you're anchoring it to the bone. You're anchoring it to the bone behind the ear. Now sometimes you can do a quick lift alone and just lift the cheek and a little laterally over the neck, or you can do the cheek and upper face and the neck at the same time. It just depends on what your particular needs are. One of the new trends for me in facial cosmetic surgery is the addition of soft tissue. I would say now about 60% of the time or more, I will add volume to the face. I get many people that come in and see me, they spend thousands of dollars on fillers, but what I like to do is I like to add your own fat. We call that autologous fat. In other words, we take from one part of your body, i.e. your stomach, we process the fat. In many cases I add PRP, platelet-rich plasma, and then we will selectively inject it to areas of your face. Now what's nice about fat is most people have an abundant supply. And number two, you can pretty much add it anywhere you want. Common areas include the marionette areas, nasolabial folds. Sometimes people want fuller lips, so we inject some fat into the lips. Very common areas below the cheekbone as we get a hollowing out. And so we can add 10, 15, I've added as much as 70 or 80 cc's of fat to the face at one time. So it's very, very common to do adjunctive procedures with a facelift. Now what do I mean by that? For example, somebody comes in, they're former smokers, got a lot of line. So what we might do is do a peel to get rid of the line, do some intradermal fat grafting to fill in the deeper crevices, put a little fat to the lips, and then do a quick lift with the neck, and then maybe add a little fat to the cheek areas, to the marionette areas, and do that all at the same time. So the nice thing about cosmetic surgery is we come in, we can say, well, we can do A, B, C, D, and E. Now your choice is you can do A and B only, you can do B, D, and E only, you can do all the above, none of the above. You have choices. And it all depends on what it is your particular dislikes are. Because after all, this is surgery for you. So what I do sometimes with patients when they come in and say, I want this, 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 I say, give me a budget. I call it value pricing. So you go home, we talk about all the options, and then come back and say, here's my budget, Dr. Brueck. What can we do based on that? So we listen to what your needs are, and then we back into it based on your budget. Now, what's the typical recovery time for a facelift? When you have a facelift, what I do is I normally put a big head wrap on, and that will stay on there for 24 hours. You'll come into the office the next day, we take the head wrap off, and if I use a drain, I take that out the next day. The very next day, you can shampoo your hair. And I tell people, get a baby shampoo. So if you get soap in your eyes, you don't scratch the stitches out, and it's a lot more comfortable. Blow dry your hair, and then I give you a Velcro chin strap that you wear for the first week with your head elevated. So basically the first 4 days lay low. Keep your head above your heart, ice on your eyes if we happen to have done blepharoplasty, and lay low. You don't have a facelift on Friday and then vacuum. 4 or 5 days, lay low. After 4 or 5 days, let comfort be your guide. Stitches come out usually in about a week. Real physical activity, golf, tennis, aerobics, 3-4 weeks. And after that, the sky's the limit. So it's really a very painless type procedure. I usually give patients pain pills, but most of my patients may take 1 or 2 pain pills that first night just to let them sleep. They come in the next day, they shampoo their hair, feel so much better. So it's really a wonderful technique to go ahead and turn back the clock and make you look younger. And the look that I'm looking for is that you look refreshed, you look rejuvenated, you don't look plastic, you don't look like you're in a wind tunnel. That's the kind of look that I give to my patients. So it's a wonderful procedure. Now the one thing I want to warn people about, and that has to do with smokers. We still deal with smokers. And I always tell patients 2 weeks before, 2 weeks after, no smoking, because we can't be as aggressive in smokers. So it's a wonderful technique, it's a great procedure, minimal downtime. And if you're interested, feel free to give our also call at 239-244-2329, or visit my website, Beauty by Brueck. And we'll happy to see you and give you a complimentary consultation.